Hi guys, YouTubers. My name is Lizelle. I wanted to go ahead and do this vlog. This is gonna be my first vlog. I just wanted to show you guys what I went through. Today is my second day of post-op of my thyroid surgery. I got the surgery done on Monday, and they took out the left side because that's where my nodule was. And yeah, so here it is. Here is the incision. It's pretty long, and they did it where my line was, the crease on my neck. I had two, one right here and then one on the top, and he just did it on top. I've seen other people, you know, where they had it right here and like, or just right here in the middle, like really little. Like, that's not fair. Why can't mine be that little? But anyways, it's pretty long, and as you can see, my neck is swollen right here. This hurts, and it's pretty kind of up here is a little tingly. It's a little numb. Yeah. My throat hurts, my neck hurts, and I can't really talk that loud, so my my voice is pretty raspy, and yeah, ouch. And there, my chest kind of hurt right here when I swallow. And I can't drive because I can barely move my neck to the side. Like, I can go like just about like right there and like there, so I'm dangerous if I get on the wheel on the wheel. So I hope you guys like this, and please be nice, you know. So I've had my thyroid disease for about, let's say, 13 years now. My daughter is 13 years old, and I found out about my thyroid when I gave birth to her, like maybe almost a month. And then I went to my follow-up OB, and I let her know about it, that, you know, hey, I feel a lump on my neck. And she just said like, oh, that's nothing, it's gonna go away, it's normal for women who just gave birth, like their, you know, neck tend to swell up, and it will just go ahead and go back to the normal size. But mine, so I mean, when she said that, I just went ahead, okay, so I guess there's really nothing to worry about. And I just went on, and it took maybe about a few years for me to finally go ahead and, you know, tell my provider, to let them know, hey, like, I've had this sorry, hurts. I've had the lump since I gave birth to my daughter, and so finally they referred me to an endocrinologist. And with that, I was seeing that endocrinologist for maybe about a couple of years, and all I've been doing was just like testing, like blood work, to make sure my levels are, you know, at the right, and also put me on medication, because ultrasound, not really biopsy so much. I guess they weren't really too concerned, because when I got the ultrasound done, it didn't seem like it was, you know, cancer. So it was just, the doctor was just concerned about keeping it maintained. And so with that, and then I had to get another one because I guess the other endocrinologist um, left, and so I had to get a new one. And with the second one, he actually recommended me to get a biopsy just to make sure that it wasn't cancer. I mean, the size of my nodule was maybe about close to like the ping pong ball, so I guess they weren't too concerned about it. And sometimes, you know, my level would be like low and high, I never know. But so I went ahead. So when my first biopsy came, it was benign, and we just went ahead and, you know, keep going with the medication, follow up, doctor. That took another couple years, and then then they switched me to another endocrinologist. And then with that endocrinologist, he had me take like a radioactive iodine that's supposed to help it like shrink, but I don't think like the size ever changed. I think it still stayed the same, and I think that's what made my nodule like harder. And because it, you know, it felt harder like after that happened, that radioactive iodine, like they have you put like on a strict diet for 3 days, and you couldn't you know, touch anybody or close to anybody. You had to sleep by yourself, you had to have your own sheet, like yeah, that was hard. And so yeah, I don't think that helped it at all. Like, and now that I moved here to Bakersfield, California, I am thankful that I actually found the right endocrinologist. Actually, the one that performed my biopsy, she wasn't my original endo. It was another endocrinologist. His name was Dr. Singh, and he had me do well, first when I moved here, I had my thyroid check because my level was out of whack, and I can tell I had anxiety. It was just really bad. I ran out of medication. So when you run out of medication, like, you're not yourself. It's like, oh, and I could tell. So when I went to my provider, she had me go get an ultrasound, and then when I got that ultrasound done, they had me do a biopsy. But with that biopsy, they couldn't get any tissue. So when I finally got to see Dr. Singh, the endocrinologist, he said that I had to get another biopsy with their office, the facility, like their actual doctor that does it. And her name was Dr. Gupal or something like that. I know I probably said it wrong, but anyways, she was wonderful. She was great. I loved her. When she walked in that room, when she saw the ultrasound, she was like, oh wow, like she could tell like my nodule had turned like calcification. I asked her, what is that? Because I didn't know what it was. She's like, it's turning into like as hard as a rock. And you know what, I think she was right, because every time I felt my nodule, like the lump on my neck, like it would be hard, like it wasn't soft at all. And before the biopsy, before the one that they couldn't get any tissues, and like I could see because like the screen where the ultrasound was, like, was right in front of me where I had turned, because you know, they have you like they had me turn on the left side because that's where my nodule was, and so I can see it, and I can see him like yanking into it, like he had a hard time getting the needle inside the nodule. As soon as he passed the outer layer, like it just, like some of it like went in. And so that's what she was saying. She's like, yeah, it's like calcification. If you leave it in there for more, like for a few years, it might turn into cancer. And so she was so concerned about it. She said, you're one of those patients that you need to get it taken out. You can't have it in there for not, like, yeah. So I'm like, oh, thank God. I'm so glad, you know, you're the doctor that, you know, did my biopsy. And actually, when I saw her again after the biopsy, she actually got some tissue from it. And like, I guess it wasn't hard for her, but all the other doctor that had performed the biopsy, they had a hard time because my nodule was that hard. But and I got the result, and it came into, it was benign. So I was glad with that. And now, you know, like, I'm so happy I got this, you know, removed. But second day, hopefully it's gonna heal fast, and wish me luck, guys. And hopefully the pathology, you know, because they didn't take out the whole thyroid. Hopefully, you know, that result will also come out to benign. Otherwise, they have to go back in there and take the rest out of the thyroid if it comes out, you know, cancer. And hopefully, knock on wood, that, you know, it's not. And I hope you guys, you know, you guys have a good night, and I hope you like my blog, and thank you so much, and good night.